ChartNeo is actually comprised of two different components, the web portal and the app, and they both serve a different purpose. So the app is exclusively for charting purposes, your day-to-day charting. So this is going to be something that your patients or your clients are using primarily. Whereas on your side, as an instructor or a physician, you're going to be using the web portal almost all of the time. And it's to work with the data that your clients are charting in the app. Okay, go ahead. Yep. And so on the portal, we have this thing called a provider. And there's been some confusion in the past on what a provider is, or what our definition of a provider is. And it's kind of the same definition that you might see in a hospital system, things like that. Provider is usually typically refers to a physician or somebody that's providing a service to someone else. So this doesn't even mean just physicians. A provider can also be an instructor, or a neofertility advisor, or some other advisor of some other method. It can also mean a clinic as a whole. And so like you can have multiple physicians that belong to a single clinic, and that clinic is considered the provider. So, and for the client is somebody who is doing the actual day-to-day charting, is connected to a provider, and you're able to see and work with their chart. Whether that's a client as in an instructor's client, or a patient in the context of a physician or a clinic. And so this slide here kind of goes back over some of the things I already touched on about how the app and the web portal serve different needs.